at 6.
Tonight we continue our news segment here on 13 News at 6. We're calling it 8 Minutes of Expertise. Each night at this time we do a live interview with a local leader on the front lines of the COVID-19 pandemic right here in our area. Tonight we welcome in Jordan Vold with Crusader Community Health. Mr. Vold, thank you so much for joining us. We appreciate it.
Yeah, thanks for the invite.
The first question is, how is this pandemic impacting Crusader? Are you seeing a surge in patients either with potential COVID-19 symptoms or other health issues?
I wouldn't say that we're seeing a surge. In fact, on the contrary, we are seeing some of these measures and some of what the community is being told, some of the messaging from the health department, from other organizations about trying to stay home. We're seeing that work. So I would say that we're not seeing a surge in patient volume. We're not seeing a surge in these sort of symptoms, and that's to be expected. We are getting more phone calls. We're getting more inquiries related to COVID, concerns about symptoms or need for testing, those sort of things. Yeah.
I'm sure you're getting plenty of phone calls that way. We've seen hospitals across the state implement visitor restrictions and in our area as well. Can you explain some of the precautions that Crusader is taking because of COVID-19?
We're following some of those similar sort of guidelines. We do want to be responsive to our patients and empathetic to our patients. That's important. But at the same time, as a lot of the messaging has been stated, a lot of the time, if someone's affected with COVID-19, there's an asymptomatic period where viral shedding can still occur. So really, we are taking similar precautions and trying to limit visitors to only what is essential for that sort of visit. We're also making sure, like a lot of other organizations, we're screening at the port of entry. We're asking questions regarding symptoms if patients are experiencing symptoms, and giving masks or taking other precautions, trying to separate patients that may have some sort of upper respiratory symptom from patients that are needing to seek care for non-ill or non-sick visits.
You are on the community health side of things. I want to talk about community health. What's kind of the biggest struggle right now at Crusader in terms of dealing with this pandemic from a community health side of things?
Yeah, Crusader, we're all about access for our patients and for our community and for those that have needs, and that those needs don't go away during a pandemic. If you have a chronic medical disease, you're still going to have a chronic medical disease. And so a challenge, as I kind of hinted at earlier, is trying to provide access for patients with acute symptoms, but also maintaining access for those that have chronic medical needs, chronic medical conditions. And so we're trying to be as innovative and having creative solutions. One of those that's integral in a lot of the healthcare institutions are starting to utilize is telehealth, and really trying to be proactive, getting ahead in some of our primary care provider schedules, seeking out those sort of patients that might have some of those needs and identifying them ahead of time, and then trying to take care of some of those things over the phone. Because if you have a chronic medical illness and you take medication, you still need those medications. But is there a way, with social distancing and limiting travel and trying to stay home as much as possible, are there ways that we can provide those very necessary medical services, but at the same time allow our patients to remain home? And we've been successful implementing some of those strategies.
That's good to hear. We've heard Governor Pritzker talk about health disparities among minorities, not just with this virus, but in general at his afternoon press conferences. Crusader is in relatively helps an underserved part of our community. What's your take on a lack of health care available for minorities and the underprivileged when it comes to COVID and when it comes to in general, and what that means for them if they do potentially get COVID-19?
Sure, and just to speak to our population, Crusader Community Health takes care of 58,000 patients in Winnebago, Boone County, the Rock River Valley, and outside this area. And we're committed to continuing to offer healthcare, not just healthcare, but high quality healthcare, even in uncertain times. So disparities are real. There's no getting around that, but that's something that Crusader exists to try to the best of our ability to break through some of these things and still deliver empathetic, high quality patient care.
I want to talk about masks when it comes to people wearing masks in public. That seems to be the biggest shift in federal guidelines. We've seen people across our community. I went to the grocery store on Saturday. I'd say about 60% of the people in there were wearing masks. Most of the workers were. The CDC now recommends everyone wear them when they go out. What should the community know about wearing masks and what kind they should get and what works for people in public?
Sure. Yeah, it is different going in public spaces. And it's interesting how quickly we adopt some of these new mannerisms. What I think is important about the CDC's recommendation is mindfulness. I think that's part when we consider all of these things. 150 years ago, hand washing was considered really controversial. You'd had physicians doing autopsies, and then they would go to the delivery room and they deliver patients, and patients were getting really ill. And the idea of hand washing was a revolution, but it was also really controversial. And we know that things like hand washing are still our best defense here. And we know that in general, we all do a pretty poor job of that. So I think when we talk about face masks, I think what's useful in part with wearing face masks is it increases one's mindfulness. It increases your mindfulness about washing your hands. It increases your mindfulness about touching your face, or even about where you're going. Am I going out somewhere where I could put somebody at risk if I were an asymptomatic carrier? So what the public needs to know is that number one, that face masks are really their primary use in this setting is to protect others. That we know that even the use of a cloth face mask is going to likely reduce viral shedding. If you're coughing, sneezing, etc., it's going to reduce your chance of transmitting virus. We know that number two, surgical masks, medical face masks, respirators, those need to be reserved for medical personnel, because that's what we need when we're seeing patients that may have those concerns. But we know that if the public at large is wearing some sort of mask, and there's different guidance, there's some pretty creative, I'm not much good with sewing, but there's some pretty creative ideas out there. And we know that using something is going to help cover up a cough or cover up a sneeze, and it's going to decrease the amount of virus you shed when you may not know that you're sick.
Yeah, protect your droplets from someone else's droplet, basically. We talk a lot in our newsroom about misconceptions when it comes to COVID-19. We've done our best to try to dispel as much of them as we can, from taking ibuprofen to a lot of other things. What is the biggest misconception that you would hear about COVID that you would like to, I guess, clear the air about?
I think a lot of people just become concerned more because of what they hear from friends or family or social media about what the symptoms could be like, or how severe the symptoms are going to be, or what the availability of testing is going to be, or that tests are being withheld or anything like that. But really, it does come back to COVID is a mild illness for most people. And you really should only be seeking care if you're having some of the significant symptoms, persistent fever, significant shortness of breath, or if you have medical comorbidities or chronic medical illnesses that put you at risk. So if you're experiencing a mild cold, or if you have a history of allergies and you're starting to get a little trickle in your throat or a little bit of a runny nose, there's no reason to jump the gun and become concerned about other things if it's mild symptoms. Mild symptoms, we want you to stay home. We certainly urge you to call in, talk it through with a medical professional, seek care with your primary care provider who knows you, and get that reassurance if needed, or get further medical guidance.
Thank you so much for joining us, Jordan Vold from the Crusader Community Health. We really appreciate you taking some time out of your day to do this interview with us. We appreciate it.
Thanks much. Thanks, James.
Let's get to Alex with a check of the forecast.